Cancer is uncontrollable growth of abnormal cells in the body. It develops when the body's normal control mechanism stops working. It is for this reason that PricewaterhouseCoopers Limited has donated a check worth 137,160 kwacha to Cancer Disease Hospital in Lusaka, which will help in improving the health facilities. Speaking during the donation on Thursday in Lusaka, the PricewaterhouseCoopers Limited partner Andrew Chibuye says the donation will help lighten the burden for government to help in Cancer Disease Hospital and improve the facility.
The objective from our perspective is to make the support that we provide sustainable, to make it available to as many people as possible. Cancer is something that we are experiencing as individuals, that we are seeing in terms of its impact, and so it's essential that we contribute in one way, shape or form. We acknowledge that there are very many challenges that are there in the country, in our society, but as a corporate entity, we as PwC believe we must do something, and that in doing something, we help to lighten the burden for the government, for stakeholders, for the people who are afflicted and affected by cancer, for the people who are working in this facility, and we intend to continue to support this cause for the foreseeable future. Hope that they can find time to come and take a look around to see what the contributions that are being made, how they are being deployed in terms of improving this facility. It's one of a kind here in Zambia. We need to make sure it's state of the art, and it's something that we are quite proud to be associated with.
Speaking at the same event, the Permanent Secretary for Technical Services in the Ministry of Health, Dr. Kenneth Malama, who read a speech on behalf of Health Minister Dr. Chitalu Chilufya, says non-communicable diseases like cancer are causing more deaths in Zambia.
A check of this nature should be a trigger to all of us. What are we doing about cancer prevention and control in our country? Receiving a check is symbolic, but there are bigger questions to be asked. The big question is, what are we doing at individual level, family level, community level to make a difference? Yes, some cancers are caused by conditions beyond our control. There's nothing you can do for some cancers. They will still come up. But the good thing is that those cancers are in the minority. The majority of the cancers, we know the modifiable risk factors, which we can mitigate or prevent. So when we talk of issues of physical activity or physical fit, there's also an inbuilt measure to prevent them being exposed to conditions like getting cancer. Issues of diet, people who take health diets, fruits, vegetables, and avoid these foods which are non-healthy, they reduce the chances of getting cancer. We're also aware that alcohol, if it's abused or misused, is a risk factor to someone developing cancer. And we're also aware that tobacco, in fact tobacco we say just avoid, is also a risk factor for you to get different types of cancers. Not only, as people may say, cancer of the lungs is just one of them. It could be cancer of the tongue, cancer of the throat, and many other parts. And now today we are being told air pollution is also a risk factor, modifiable risk factor for someone to get cancer. So the factors I've talked about, if you indulge in 5 of those, then the risks of getting cancer in your lifetime increases. Remember, with cancer, the risk starts before you are born. And as you are born, exposure to the things I've talked about, among others, then you start building up the risk. You see by the time you are 30, 40, 50, 60, cancer starts showing.
Cancer Disease Hospital Medical Superintendent Dr. Louis Banda has thanked the PwC for the good support.
We have improved it to an extent that there is a safety cabinet which we've included now, as well as we are using what we are calling a closed system, so that they are not being exposed to the fumes of the chemo, because they can end up getting cancer themselves or getting sick or becoming infertile, because those are the risks of reconstructing chemo. So in that environment that we've created is of an international standard where we can protect our workers.
And Piers Hachizo, a senior pharmacist, gave a vote of thanks.
In the life of chemo safety, when the whole world now is migrating to what is called the USP 800, USP 800 is a chapter that makes, please take a bow. Please take a bow. We are so thankful and we look forward to a durable partnership.
Cancer can cause pain and loss of function of one part of the body. Marangi Zombola, CBC News, Lusaka.